I will support and defend the Constitution of the United States
that I will support and defend the Constitution of the United States
and the Constitution of the State of California
and the Constitution of the State of California
against all enemies.
So for the people that don't understand what the AB 918 is, could you explain it briefly?
Sure. So AB 918 was the effort from the state legislature to agree with the stakeholders here in Imperial County that our healthcare system was at risk and that the three districts or the three institutions needed to come together and work together and be under one flag.
Okay.
And the problem is that for 25 years, we had personal egos, we had parochialism, we had so-and-so doesn't get along with so-and-so, just whatever. That was keeping us from getting there.
We're right here with, what's your name?
Donald Meadart Jr.
Okay. What could you guys tell us about the AB 918 and how that's going to benefit the community?
It's going to bring the community together to bring better healthcare, a better healthcare system. So therefore, we won't have the fear of any facility closing whatsoever in the future.
The Assembly Bill 918 would consolidate the healthcare within the Imperial Valley to provide a better healthcare system for each and every resident of the Imperial Valley in order to bring us closer and to have a tighter control over the healthcare that we receive as people of the valley.
That is our job to find out and investigate. So until we are able to all the finances and come to a conclusion, maybe with a financial consultant or a bond consultant or whatever, we won't know that answer until then. And that's one of our jobs to do. So, yeah.
As far as the history of the finance of the healthcare system of Imperial Valley, at this point, just like everyone else, we don't know exactly what transpired and how we got to the point where we're at. And so I believe that the first order of the board to bring in the CFOs and to hear firsthand how we got to the position that we're in is an important building block in a strong foundation moving forward as a healthcare district.
How can the new board of directors ensure that the same thing is not going to happen?
So I think a start is to put policies and procedures and ensure that those are followed, that have fiscal responsibility to make sure that this doesn't happen again, to make sure that the employees and the board is held accountable. I would encourage the public to hold all the board members that are on this accountable. These are all, elected. These will be elected positions, and if you don't like what they're doing, then you have every right as a citizen to come voice your opinion at a public comment. You can choose to not vote for your director, and I would just encourage all the community to stay engaged, because when we have an engaged community, I would say, issues like this usually tend not to happen.
Frank Brayback, and I'm the president of the Imperial Valley Coalition for Sustainable Healthcare Facilities.
So what's your opinion on the unification of the hospitals?
Well, it could be a good thing. There's a lot of information that still needs to be had. The detailed financial and operational analyses that have been, I believe there's been some done. There's a Kaufman Hall study that's been done on El Centro that will be available to this board. And anything that will allow for this new board to take a look at all, again, the finances, the operations, and determine how to go forward from there. Well, running a hospital is extremely complicated. It's like running a city. A lot of different departments and a lot of different things going on. I mean, think about it. I mean, you've got food, you've got linens, it's like a hotel, but with doctors and nurses and all these other people that not everybody thinks about when you're talking about hospitals. So it's an extreme challenge to fully understand everything. I mean, even for administrators to keep their arms around all the things that are going on in their hospital is an extreme challenge, and especially now because things have become more complex. Reimbursements have dropped. Insurance companies are increasingly more difficult to work with and get paid and negotiate proper rates. Of course, doctors are in shorter and shorter supply, so they get to be more expensive to keep or attract. Same with nurses, right? And same with all the special areas, from the people that have to do the billing to the cafeteria workers and the janitorial services. I mean, it's salaries are going up across the board. So for a hospital, that's very difficult. So those are just some of the areas that make it more of a challenge. So that's what our coalition is trying to work on, is to try to get as much of that data as possible so that we know where they're at, and and include the population in the area to weigh in. And it's good that this board has invited input. That's very important. I was really pleased to hear that, because that's vital. That for them to make those decisions, and that's exactly we're parallel as far as looking for the proper data to make the proper decisions based on it.
How did the El Centro Hospital get to the place that it got?
So it got to the place that it got because it took out a $125 million bond to fix the buildings that were not seismically compliant, right? And seismically compliant was what the state put after major earthquakes that were damaging a lot of hospitals. And so they put this metric, and El Centro Regional pioneers fell below. So in order to improve it, ECRMC took out that bond, and so now we have to pay it back, right?
Okay. And did the